Hi, I'm Bailey Mills. My videographer is Alex Smith, and my evaluator is Lauren Cook. And I'm about to start my medication administration checkoff. So first, I'm going to be going into my simulated medication room or Pyxis type thing. I'm going to start by performing hand hygiene, and then I'd first look at my patient's chart to verify if they have any allergies, labs, or any other factors that would contraindicate the medications that have been prescribed. So I've also already checked my provider's orders, and we'll be administering 3 medications. So I'm going to start with checking also the expiration dates of all of the medications, and then looking through my 5 rights and doing that for each medication. I'll start with my erythromycin. So I have my erythromycin here. We have right patient, which is Mr. Wheeler, right drug, erythromycin, and then right dose, which is 250 milligrams, right route, which is by mouth, and then right time, which is now. All right, so we have this one, and I've also checked the expiration, and we're good for this erythromycin. That was my first check for that one. Next will be my varicella vaccine, and I'm gonna pull this out. All right, so I have my varicella vaccine. I've checked my my expirations, and then I'm starting with, it is right patient, Mr. Wheeler, right drug, varicella, right dose, which is 0.5 milliliters, so that's correct, and then right route, subcutaneous. So in this case, for this subcutaneous vaccine, I'll actually be giving it in the abdomen. Normally I would give it in the back of the arm, but for the sake of the mannequin, I'll be giving it in the abdomen. And then right time, which is now for this vaccine as well. I'm going to go ahead and get out my materials for this as well. For this, I'll be using a 3 milliliter syringe and a 25 gauge needle. Alright, and then my last medication is dexamethasone, and so get that out. I've checked the expiration, we're good there. We have right patient, Mr. Wheeler, right drug, dexamethasone, right dosage, which is 4 milligrams, and then right route, which is IM, and I'll be giving that in the deltoid, and then right time, which is now. I'll also get everything out. Alright, and then for this injection, I'll be using a 3 milliliter syringe, and this one is a 23 gauge needle. Alright, so that was my first check. I'm going to go ahead and do my second check in the medication room outside of the room before I enter the patient's room. Same thing, so my erythromycin, we have right patient, right drug, erythromycin, right dose, 250 milligrams, right route by mouth, and right time, which is now. Right. And then second, my varicella vaccine. I have right patient, Mr. Wheeler, right drug, varicella vaccine, right dose, 0.5 milliliters, right route, subcute, and then time is now. So we are good on those 2. And lastly, my dexamethasone, we have the right patient, Mr. Wheeler, right drug, dexamethasone, right dosage, 4 milligrams, right route, IM, and then right time, which is now. Alright, so I've done my 2 checks before I enter the patient's room, and now I'm about to enter the patient's room once I gather all of my medications. Alright, so hi, Mr. Wheeler. My name's Bailey, and I'm going to be your nurse today. I'm going to go ahead and verify your name and date of birth, please. Alright, so this is the right patient, and then I go ahead and ask Mr. Wheeler about his allergies, if he has any other allergies besides the ones that were noted on his chart, which was codeine. And now that I perform hand hygiene, I will put on gloves. Alright, so I have my gloves on, and then now I'm going to be providing privacy. Yeah. Alright, Mr. Wheeler, we're going to be administering your medications today. The first medication that we will be administering is your erythromycin. So I'm going to go ahead and get everything ready for you, and then we'll get started, okay? Alright. So I'm going to do my third check by the bedside for all of my drugs as I go. So this first check will be for the erythromycin. I have my right patient, Mr. Wheeler, my right drug for erythromycin, right dosage, which is 250 milligrams, right route by mouth, and right time, which is now. So then also I'm going to go ahead and explain to Mr. Wheeler exactly what this is for. Okay. So Mr. Wheeler, this erythromycin is an antibiotic. It's going to help you with any infections that you have that you came in for. As far as side effects, if you feel any any nausea or vomiting, those are pretty common side effects with erythromycin. And if you get any of those, just let me know and we'll get that covered for you. So next, I've done my third check and I'm ready to administer the medication. Alright, so I'm going to go ahead and sit you up, Mr. Wheeler, so that you can take this. Alright, that should be good. Alright, so here is your erythromycin. I'll give him the cup. We'll take it, and here's your water. Perfect. And then I checked to see if he swallowed, and he did, so we're good with that. Alright, so next, Mr. Wheeler, we're going to be doing your varicella vaccine. We're actually going to be doing this in the right lower quadrant of your abdomen, so it's usually in the back of the arm, but for the case of the mannequin and for this video, I'm doing it in his abdomen since it is sub-Q. So I'm going to do my third check of this varicella vaccine. And I have my right patient, Mr. Wheeler, right drug, varicella vaccine, right dose, which is 0.5 milliliters, right route, sub-Q, which is why I'm doing it in the abdomen, and then right time, which is now. So I'm going to go ahead and get this prepared. Alright, so since this doesn't have a top, then I'm going to rub this with alcohol to disinfect. I would be doing it for a minute for the sake of the video. I'm not going to be doing it for a full minute. Alright. I'm going to film right now. Ready? Alright, Mr. Wheeler, we'll be back in a few to check on you. Now I'm going to
So first I'm going to go and check out the
Alright, so the dose is 0.5 milliliters. So I'm going to go ahead and draw back 0.5 milliliters of air in my syringe. The syringe again is 3 milliliters. So 0.5.
I'm going to start by washing my hands and
Great. And then I'm going to go ahead and remove my cap.
Wheeler, she was admitted from the skilled nursing facility yesterday. She has a past medical history of mild dementia.
And then insert it into the vial.
The patient was significantly more confused than usual.
And then I'm going to insert the air in, flip it upside down, and then I am going to pull back my 0.5 milliliters of the varicella vaccination.
So it looks like we have Jamie Wheeler, date of birth 10/31/1947.
Right.
Dr. James Folks, allergy to COVID. She was prescribed today.
Right. And then I'm going to actually go a little further back because
Erythromycin, 250 milligrams per Oz.
I have a little bit of an air bubble.
She was also
back to get everything out on the top, and then push back up to my 0.5 milliliters. Alright. And then I'm going to be doing the scooping technique so that I can switch the top. Alright, put this away. And then I'll be ready to attach my needle. Alright, and then same thing. I'll be putting the sharp and attaching my new needle. Alright, and then I have my safety. And then, like I said, the varicella vaccine will be administered sub-Q. So, Mr. Wheeler, this is going to go in your stomach, right in your lower abdomen. I'm going to quickly pull this down. We're going to expose you just a little bit so I can get right in your stomach. Alright, and then Mr. Wheeler, before we begin, I just wanted to let you know that this varicella vaccination is going to prevent you from getting varicella, and then as well, if you have any like common side effects such as fever, redness, rash where the shot is, so right around your stomach, let me know. We'll get that checked out for you and get all that handled. I think we're ready to go. Go ahead and clean off the area with this alcohol pad. I'm going in the right lower quadrant, starting in the middle, going outside. Here, spot. Alright, and then I'm going to be pulling off my cap. And then since this is sub-Q, I'm going to be holding the abdomen and then a little pinch on 1, 2, 3. Alright, and then I'll slowly inject the medication. Alright, and now that all the medication's in, I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, and then I'll release, pull out, and gauze. Alright. And then apply my safety on the table. Dispose of it in the sharps. The gauze. Alright. Great job, Mr. Wheeler. We're almost done. One more injection. Alright. So then my third check for my dexamethasone. So this is an IM injection. It will be going in the deltoid for Mr. Wheeler. Shouldn't be painful for my third check. I'm checking my patient, which is correct, Mr. Wheeler. Right drug, dexamethasone. Right dose, which is 4 milligrams. Right route, IM. So I'm doing that in the deltoid. And then right time, which is now. Mr. Wheeler, as far as for your dexamethasone, it is used to suppress your inflammation that you've been having, and then if you have any common side effects such as depression, euphoria, any hypertension, any nausea, anything like that, let me know. We'll get that covered. Alright, so I've done my third check for my dexamethasone, and I'm ready to prepare my medication.
If it's one that's like, you do it,
So same thing, this medication has already been open. I'm going to clean the top for a full minute. For the sake of the video, not doing it a full minute. Clean, clean, clean. Great. this one is 4 milligrams, and so 4 milligrams per 1 milliliter. So I'm going to pull back to 1 milliliter on my syringe of air.
18 gauge times 1 inch blunt needle versus
Alright,
drop.
perfect. And then I'm going to insert into the vial.
Gauge 5/8 inch needle for injection.
Insert the air into the vial.
So now I will be like 1031.
And now I'm going to pull back my 1 milliliter.
One dose ordered today at 8%. So we have the dexamethasone 4 milligrams per 1 ml. So she's getting 4 milligrams.
Alright, same thing. This one has a little bit of air bubbles. So I'm going to pull back and push up to my 1 milliliter.
So this is dexamethasone.
Same thing. My scooping technique.
And that put me here for the incident, and drop out in 10 minutes, for the actuation date, 2030.
And that's the IM injection. Okay, so we just
And now I can attach my 23 gauge needle.
outside of it though, we're just gonna do the
I
second
didn't have a woman, nurse this evening.
before we enter the patient.
You mind
So
telling
we
me your
have
name?
Jamie Wheeler,
Date of birth?
ordered today, erythromycin 250 milligrams.
Record,
per
obviously, like 14 hours.
every week.
Alright, Mr. Wheeler, this one's going to go on the top of your arm, right on your deltoid.
Right.
Just bring this up a little bit. I'm going to start by cleaning off the area
Then
right
we're gonna go
before.
ahead and,
So this is
Johnson medication.
So I'd start right at my side and go outwards.
One
Jamie Wheeler,
I'm gonna make sure it's set for you.
231, 245.
That should help.
My gauze in the middle.
Then we're gonna get a B12.
Inactivate my safety, and then I pull my cap.
Put that in your
Times 1 at 800. Expiration
Alright,
date
so since this is an IM injection, I'm going to be doing my Z-track. I'm going to find my site halfway through, and then I'm going to pull this way, and I'm going to inject a little pinch on 3. 1, 2, 3. Alright, and then slowly inject my medication.
How's your ability to
Count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release my Z-track and then pull out. Gauze. Whoops. Alright, my gauze. And then I activate my safety on the table, making sure I don't stick myself. Alright, next I'm going to make sure that I've documented all of my medications. So, documenting my
I'm gonna go ahead and
alcohol swabs,
provide you your
distortion.
so
It's fine.
deductions.
Okay, so I document the time that's given, everything, including medication name, document signed. Alright, and then I would obviously come back to check if there were any adverse effects for Mr. Wheeler. Mr. Wheeler, I want to let you know that if you have any weird side effects such as nausea, anything that I told you before, don't be afraid to hit your call light, let us know. As far as the procedure, the patient tolerated it very well. I don't know any adverse effects as of right now. And I think I would remove my gloves and perform handheld.